Hi, this is Karen. This is like the third part of a little series of talks I've given regarding some questions from one of my followers. This part is about someone finally wanting to go to treatment. This person, her child finally wanted to get some help, adult child, and went to detox. Now, there's multiple things going on with this person's life where they are having pancreas problems, liver problems, besides acute alcoholism and needing to detox. There's other medical issues, and he went to detox, and they said, okay, we're going to let you go because we need to deal with your pancreas. I don't know how to say it. It's pancreatitis. I think pancreatitis, and we need to get you into a different kind of detox for that. And there's no detox bed available, so we're going to send you home. This is very frustrating. And I just want to talk about it really briefly and give you some pointers from my experience. When you send someone to the hospital for, I've had someone with like a 0.45, like death of a alcohol blood level. Unbelievable, right? Several times have had people like that. And I've sent them to the emergency room or driven them myself or called an ambulance. And you get to the emergency room and they start to kind of bring them down, and they give them, can't think of what it is. Jesus. Anyway, they give them medicine and they start kind of detoxing them. And they kind of start giving them some fluids and it's Ativan. I got it. Anyway, they give them Ativan, which is like liquid alcohol, and they start bringing them down, and they start giving them fluids, so that brings up their dehydration, right? Get them hydrated again, and they start kind of feeling a little better, and they let them go. And it's like, oh my God, please don't let them come home. They're going to drink the minute they leave. For this person who's got other issues going on, I can understand it, that they want to get him better care, but letting him loose on his own in the meantime could kill him. And I understand the family members very concerned. So I want to tell you a few things. First, when you get somebody in the hospital and they're in that condition, and they have this one guy, this friend of mine, his blood alcohol was like 0.46 or something. He should have been dead. And he'd fallen, and he had this, it was all bad, right? Blah, blah, bruises and bleeding, and take him and as soon as they find out that he's an alcoholic, it's like, whatever, quit the bleeding, give him some Ativan, give him some fluids, and let's get him out of here. Now, you can't be mad at the medical industry, because alcoholics and addicts, and I say this because I am an alcoholic addict, are notorious pains in the asses. And we go, we start getting sick when we don't get our drugs or our alcohol, and we go to the emergency room and we want help. And these people have people with strokes and heart attacks, and it seems to them like we are self-inflicting, right? That's what it seems like to them. Like, here we are, we're taking our time to help you, miss, do an 8-ball in a half an hour. And there's a guy over there that needs our help who's having a heart attack. So you could see that they get frustrated, and we're repeat offenders. When we go to the emergency room, we're in there like 3 times a week. So they get to know you by name. So you can't be really too upset with them, but you can handle it differently. And this is what I want you to do. If you have somebody in there, like this gentleman's in there now, and they're ready to release them, you ask for it's like a social worker. It's a patient advocate. Ask for a patient advocate. Say, we'd like to have a patient advocate. Well, why do you need a patient advocate? Because we need this person to go straight into detox. Okay? We need this. We need a detox bed. We need some help with this. Please don't let him go until we speak to some help here. If they give you a patient advocate, and you should be given a patient advocate, if you ask, there's these little things on the wall that are your rights. You have a right to a patient advocate. Okay? So you get a patient advocate and you say, hey, I understand there's no beds available, but he has pancreatitis and and liver disease. His liver's failing. I'd like you to keep him in until a bed's available. We'd like you to keep him here or in an assisted health facility, one of those gradual stage one, don't send him home. We need some, what are our options? And you toe-to-toe with the hospital. Toe-to-toe with them. Hey, what are our options here? Well, you could private pay and get him into this fancy place. We don't have any money. So what's our other option? Right? He's going to die. What's our other option? Ask. Doesn't hurt to ask. Ask for a patient advocate. You'll be amazed at what a patient advocate can do. They can find another hospital for him to go to. If this hospital doesn't have a bed, or if they're not situated, they can get him to another hospital. They can get him to a nursing home. At least he won't be home alone, right? They can monitor him and keep an eye on him and feed him while he's waiting for a bed. I mean, there's got to be some options here. The same thing when you go in and you take someone to the emergency room and they're drunk out as a skunk and they say, well, we're going to let him go. He's fine now. Blood alcohol is 0.5. Well, he's a danger to himself and to others. You know, right now he's a danger to himself. What are our options? Can we have a patient advocate, please? Patient advocate says, what would you like to do? We want to get him into treatment. We want him to go to treatment. Do you have any money? No. He has state insurance. She will find a place, a bed for state insurance. Okay. So you have this option. A patient advocate is what I would ask for. Drug addicts and alcoholics are notoriously ignored and pushed out of the hospital. And you know what? I get it. So please, if you're a nurse and you're in the emergency room and you're sick and tired of us, I understand. That's why I'm doing this work. I'm trying to help people get sober so they do not continually keep coming to your emergency room and taking up your valuable time. But they're sick people. We are sick people and we are dying. So we need some kind of help. Now, if they don't have a patient advocate, maybe we'll push they'll have one, but they might have one advocate for like 400 patients. Well, maybe they need to hire another one, right? So you want to press it a little and ask. It doesn't hurt to ask. Well, can you keep them in here until a bed's available? Can you keep them until I find a bed? Right? I'll hop on the phone and find a bed. You tell them whatever you got to tell them, but ask for the help, okay? It does not hurt to ask for help. And then pray, because God will open doors and open up detox beds. I've seen it happen before. So ask God for some help. Thanks. Bye.